So what is cancer? It's a normal cell that's begun to grow in a fast and uncontrolled way. It requires dozens of mistakes in that cell. And by definition, cancer cells will penetrate into normal tissue surrounding. If it's benign, it's more kind of pushing, but a malignant tumor penetrates into the surrounding tissues, or it can get into the lymph system or the blood system, like seedlings that float around and land in a lymph node or a distant site and begin to grow 1 to 2 to 4 to 8, and that creates a metastasis at a different site. So that's, by definition, that infiltrative growth or spreading elsewhere is what cancer is. Each person's cancer is different. Each person has a different set of mistakes and different personality, and so therefore the person can always do better than is expected. You can't compare yourself for that reason. And so thinking about it, we have this human body. How does cancer cause problems? So the tumor or the cancer can grow at the primary site and get bigger and bigger and bigger and cause problems. It can spread to lymph nodes and get larger and cause blockages and pain and so on, or it can spread elsewhere in the body, called metastasis. And you can think of a lump, a growing lump at some area, can do a few things. It can press on the nerves in that region, that can cause pain. The tumors kind of grow out of control and their blood vessels are fragile, and so it can bleed into the tissue, or then coughing up blood or bleeding into your kidneys, for instance. It can block a tubing that goes to a kidney, or tubing within the liver itself. And essentially, it can cause the organ to dysfunction. You lose brain function or kidney function or liver function, so on. The cells are obviously growing faster and therefore taking up more energy from the body. So people suffer from fatigue when they get cancer. And essentially, from kind of Western medical perspective, the treatment is designed to kill, or if you don't like that word, sterilize or neutralize the cancer cell. So that's how we aim our treatments, per se. So just generally speaking, if you have a cancer cell here, and this is the DNA, radiation is like an invisible wave that goes through the tissue and hits the words and sentences and kind of knocks out more words and sentences to debilitate the cell. And chemotherapy has to kind of soak through the tissue. Sometimes it has targets at the surface, but usually it goes after the DNA as well. So that's how, generally speaking, treatment works. So traditional chemotherapy, and chemotherapy is getting better because they're using what they call targeted, meaning it's going right after the cancer cell and having very little effect on the normal cells. But typical traditional chemo is going after fast-growing cells. And so typically that's cancer cells, but you're creating blood cells all the time through your bone marrow, and so those cells can get depleted. So the red cells are getting oxygen, which helps with fatigue and energy. White cells around infection. So people on chemotherapy typically have about a week where their white counts are low and therefore at risk of infection. And platelets help the blood clot, and so they can be at risk of bleeding as well. And other areas where you think about fast-growing cells, the whole mouth to bowel system can get irritated. I mean, people oftentimes lose hair during chemotherapy because of the fast-growing cells. Radiation's aiming at a particular area, and so really the side effects are almost at that area. And you can think of it kind of like a sunburn on the inside is probably the best way to think of radiation causing some type of side effect. Yes, you can have some fatigue with radiation, but it's certainly, generally speaking, it's easier than chemotherapy. If you're getting radiation to your stomach or gut, you can have nausea. Radiation to your brain, you can get nausea. But typically radiation is pretty well tolerated, given over a number of weeks, 10 minutes a day. And lastly, from kind of and we're going to get into specifics here, from a surgical perspective, we're cutting out tumor and then having to stitch the tissue together, and scars, whether at the skin or deep down, contract in order to gain strength. And so really, you're kind of getting that strengthening of the wound over a couple months. And then after that, oftentimes you want to make sure this tissue has the normal stretch to it. So there's stretching after time. I'll get to some specifics in a moment. So this is just a diagram showing radiation treatment. Person's typically lying still for about 10 minutes. Some beam that they can't see or feel is going through the body, the chest. If there's a breast cancer situation, give radiation to that area. Talk about immune function. Again, I'm staying kind of scientific paradigm here. So cancer, some cancers, there's certain type of cancers, melanoma is kind of known to be related. Some blood cancers really are affected by the immune system. And so we want to make sure our immune systems are strong for lots of different reasons, including when our white counts are low, we still want the immune system to be able to identify the bacterial to help them with time. And obviously, if we're feeling stressed, anxious, nervous all the time, that stress actually inhibits immune function. And as we practice meditation, being more peaceful, it actually boosts immune function. Just a diagram to say sometimes there are white cells that can identify the cancer cell as foreign, and they could actually eat or destroy that cancer cell. So that's the kind of background in terms of kind of medical side. Now I want to give you kind of a quick overview of what I call complete cancer care, or you might hear integrative medicine. We're combining what you can do from a medical perspective and then combining that or integrating that with body, mind, and spirit, which is an overview of integrative care. First level is understanding what's happening, getting that information. And you actually have this in your handout as well in terms of those things. And the second level is just negotiating and getting the best care from the medical system. And that's a whole attitude and a whole potential talk by itself. I'll touch on a few points here, extremely important. And this is the stuff that you would totally understand, is the idea that we can actually influence our outcome by empowering the body, actually changing the chemistry, improves a lot of different things in terms of quality of life and so on. And so there are many cancers like breast cancer, prostate cancer, colorectal cancer, endometrial cancer, where we can influence longevity through those kind of healthy habits. And I'll touch on that as well. So really, it's a powerful part of it. And the last two levels I say is the healing skills, is the idea that stress reduction, reframing difficult thoughts, the neuroplasticity and using our mind to actually influence our body can have a very powerful influence on a person's through cancer. And lastly, tap into something that's kind of bigger or transcendent beyond, the kind of mind-body system. That's beyond kind of Western science, but I think there is an influence of consciousness, and bringing your consciousness into your body actually empowers the body. That's the next phase of my life, to try to demonstrate that in some way. So it's important to understand the medical system so that we can get the best care possible, advocate for oneself. You do it well here. But essentially you're doing all those things so that you can have a good conversation and get the best care from your physician and team. And I talk about the nurse. The nurses here often have excellent insight. But you're getting that best medical advice, and you're preparing by researching there. And just to say, there are lots of great sources of that information as well. And think about not kind of burdening oneself, burning out, looking for the magic cure all the time, and keeping life in balance on that side. Advocating for oneself, so that's that preparation. If there's an issue or question, you're calling, you're finding out what's happening. There's a whole bunch of extra systems. I mean, think about Raylene and, the lymphedema expert or the rehab expert or the physiotherapist or, social work. There's so many experts within the system that if you don't ask for that particular consultation or advice, you may not get. That's the point. So that's the takeaway, is that you need to prime your physician or your nurse to say, is there anybody else? Do I need to see a nutritionist? I'd say yes. Do I need to see the librarian to help me here? And the idea is, you're the most important person in the room when you walk into the room, not your physician, right? So you think they're here to serve me. It's really the attitude. So that's the influence around that. And just, as I said, there's a whole bunch of other great team members who can really help on that side. To follow, in fact, this is the kind of the teaching on this side. So beyond the Western medical, which I totally endorse, is to be able to follow your heart into what's right for you. And the following entails two ideas, kind of the two great wings of the bird, is doing your research and using your logical mind, but also following your intuition, because the intuition actually is tapped with great wisdom as well. So you want to do both of those things. If you're going to take something by mouth or IV or something, you want to tell your physician, because there could be some side effects between the two. And I would say don't go the proven. If the medical system says, this is the chance of cure of doing this, then I think that's probably the best way to follow it. And that's my opinion. The idea is conventional medicine is kind of look, what are the risks, what are the benefits, and really being able to document that and be able to offer that. The issue around the alternatives is it can be expensive. Sometimes the practitioners are not offering the truth in some sense, but more and more we're able to figure out the toxicities and so on. And so really the takeaway is to be smart about this. If you're going to buy a car, for instance, you're not going to just get the information from the salesperson. You're going to actually do the research, read your consumer's report, whatever else. You want to do that same type of thing within the complementary world. What's the level of evidence? How good are the trials? What's the risk? What's the cost? Okay, I'll just flash through this because I want to get to specific issues. So exercise, it has to be cardiovascular as the part of it. So there's strength cardio and stretching, but you have to get the heart up and pounding, like lightly pounding for 30 minutes a day, 6 days a week. 150 minutes a week on average is the idea there in order to have the kind of benefit from exercise perspective. And I really could rant a long time about how this is very, very empowering there. But there's nutritionists, you're going to take your vitamin D in Maine and New Hampshire. We're going to maintain a reasonable weight. Compassionate with oneself around that is the most effective way to continue to work with that. Sleep, taking a nap, is actually healthy, improves the quality of sleep at night, and people wake up more rested the next day. There's a whole bunch of stuff around sleep hygiene, including staying in the dark. Right. Lastly, there is very good documentation around actually practicing relaxation, getting that kind of chattering mind, that bringing back the attention to body or breath is very, very powerful. I can talk about that later. I want to also normalize this issue of that people affected by cancer suffer emotionally. It's the normal expected thing when we have a certain expectation of what's going to happen in the future, and then we're also looking at our own mortality that we may not have looked at before, can cause this incredible sense of stress and suffering. And so 1 in 3 people affected by cancer will either suffer severe depression or kind of debilitating anxiety at some point in their journey. It's normal. And we can normalize that. We can accept that there. And typically, it's almost like the frontal lobe has been detached and it's kind of more a primitive system of anxiety, irritability, sadness. And sometimes people can't even put a word or a cause to it. They're in that kind of raw emotional state. And so these are the normal emotions that come up. Fear of recurrence is the big one, right? Fear of death is really fear of recurrence. And that uncertainty, we as humans are not good at living in that uncertain state. But you're going to start to think about how you can consider your yoga class in terms of coming home, finding that groundedness, loving oneself is really important issue. The body image, same idea, sexual health, just being able to tap into spirit and spaciousness. In this moment, there are billions and billions of things that are going right with you, way more so than are going wrong. Right? And so it's true for anybody who's to a cancer diagnosis. Garnering that space. Oh, and obviously the family challenges are a big one. And somebody said today, each person really approaches or experiences their cancer diagnosis in a different way, and I totally endorse that idea, is it's so diverse, changing. So if you feel lousy right now, you might feel better next week. That's the kind of human experience, right? Is that sometimes we feel great, sometimes we feel lousy, and that's normal. Many other issues, and Michelle will also touch base on some of this, but realize that it's very complex and a person's life can be shattered in so many different ways. And when we're in that really lousy, difficult, stressed space, whether it's depression, anxiety, anger, fear, whatever, in terms of how we approach it is, first of all, I'd say to accept that it's happening. It's kind of the first level, and then to work with it and find out how is best But generally speaking, there's no like one set of, you must see a counselor or you must do this. You're going to find your own way. I think it's extremely helpful to have at least one person in your life who's that wise spirit, who can simply talk to you, doesn't have to correct your problem, and that things will change with time. The recent science shows that being compassionate with oneself is actually the best way to make a change with time. So people who relapse on their diet or something like that, if they're hard on themselves and beating on themselves, is not as effective as just being kind and saying, well, you know what, I had that relapse there, but I'm going to try better next time. I'm human. I can do it. Type thing. So the compassionate side is the best way to go. What are the red flags to say that you might not be able to do this all by yourself? And so obviously a person is super depressed and withdrawing from the social contact, a father that doesn't want to spend time with their kids anymore, unable to enjoy life at all, talk about treatment, can't sleep, terrible memories. Those are all cues. Hear that in the conversation. You might say, well, why don't you go see a professional, counselor or social worker? So you need to get help when those things come up. How do you get that help? So be open and honest. I think that's part of it. When you're in with the medical professionals, mention what's happening. They can oftentimes refer you. There are systems whereby you can get that advice at the cancer center directly. Find the expert. Support groups are very powerful for lots of different reasons. Okay, I want to take that medical information specific around yoga, and Michelle has some excellent slides here. So there's lots of great scientific data that yoga really makes an impact in terms of quality of life and many of these issues. It doesn't necessarily improve the chance of cure, but that's certainly possible as well. So lots of different symptoms can be alleviated by that both technically proficient and heartful yoga, the two wings of the bird again. Potential harms, and this is why I'm trying to empower you so you can go away knowing what you have to see and then just be able to relax into any situation and say, well, this is what's happening, I can see it and I can respond from that kind of centered space, so that we don't have to be fearful. We can actually be kind and loving as we're making decisions as we're going forward. But essentially, it's very low risk. I'd even say that we should almost be prescribing it. Lots of different benefits, and that we want people to stretch and move and connect with their spirit, after surgery and so on. The takeaway point, one of them is, if someone's had breast reconstruction, I'll talk about this in a moment, that you do need to get the advice in terms of what their person's capable of. I'm showing this slide because I want you to see it from an anatomical perspective. The breast tissue is soft tissue. The muscle underlying it, the pec major and the tendons, et cetera, are the kind of firmer hard tissue. The soft tissue has some pliability. It's kind of more stretchable. And so therefore, it's very hard to cause damage to kind of the soft tissue. There's a surgery site in the armpit, surgery site in the breast. They actually did a biopsy there, taking a sample of tumor there. I'm showing you this diagram because this is the scar that's underneath the wonderful yoga outfits. So there's a scar at the level of the breast, for instance. It can have a little bit of retraction of the tissue, the level of the breast, and also showing you the scar in the armpit area there. This is a mastectomy, so the breast has been removed. You're left with a scar across the chest here. And again, remarkably, it's very, very difficult to rip open the mastectomy site once it's healed, because the tension is actually on the muscle and the ribs and not soft tissue that's superficial here. Okay, so post-surgery, what happens, someone goes through the surgery and they're in pain, therefore, and their natural inclination is to not move the joint and muscle very much, and it leads to kind of contracture. We lose flexibility, and there's a possibility of frozen shoulder. And so really, the surgeons are telling their patients from about 2 days on, they actually want to start stretching and moving and so on. Yes, again, we want to listen to discomfort for the first 3 months, but beyond that, you're actually wanting them to kind of push through a little bit the discomfort and slowly over time get back the flexibility that's in their arm. And so if it's not reconstruction, I think we can be confident to allow them to listen to their bodies and allow themselves to push forward. There is couple of exceptions though. This is the idea that there is a collection of blood or fluid within the breast, and they stick in a tube underneath the skin, and they see it as a little, appliance here as well, and could go into the armpit area or the breast area. This is a situation if someone shows up into the yoga class with a drain in place, say, great to have you here, let's hear your story, but I want you to come back, for actual yoga once the drain's out and you're starting to heal and your surgeon is giving you the okay. And the reason being is that these tubes are connected in by single sutures, so that's easy to rip out. Second thing is you can see some redness around the wound here, so it's a source of potential infection as well. So breast drains, no yoga, I think is the takeaway. Michelle's giving me the nod. Good. The other one is implants as well. You're probably going to need the direction of the surgeon or physiotherapist to guide you as to what and when you can do yoga. I just show you this partly because this implant is underneath that muscle, so that's been implanted in there, and it can, because you can stretch muscle, you're putting more pressure on the implant. And that's why it's an issue. It needs to be kind of healed in completely before they're starting to stretch there. So again, you're going to get expert advice. Lastly, I want you to be able to visualize someone has the breast removed. There's tissue that's removed from the abdominal kind of tummy tuck type of situation, and they tunnel it right underneath the skin right up to the breast and create the breast from this. But you can imagine that there's all this tissue that's going from here up to here, including all the blood vessels going from the lower abdomen right up to the chest wall. The blood vessels don't have any kind of strength to them, and so you could literally break it, snap it open, or if you hold yourself in a compressed position, you're pressing on those blood vessels and you're losing blood supply to that area. So again, reconstruction, you need the advice from the surgeon. Yeah. Wow.
And I got into yoga because of that.
Right. Wonderful.
Because I had to figure out a way to work my body.
Yes.
Completely deformed.
Yes.
So.
Good for you. And it worked, yes? And over the years you can do this and kind of stretch and so on, but it's, the body does adapt, which is the wonderful thing as well. And so I just wanted to show you what it looked like on a body. So somebody can have a scar low down and the breast tissue gets kind of pulled up there. I guess it's on that side. Yeah. Good shape, fair visual.
What's the typical recommendation? How long post-transplant surgery are they recommended to start activity?
No. So I think to talk with the experts. So thanks for that good, precise question. Yeah. And it depends on the surgeon and management as well. So get the limits. Pain is not an indication, right? Because the blood vessels don't have this kind of pain in it. Okay, we have a lymphedema expert here as well, but just to touch on it. So that swollen tissue, lymph is the fluid that kind of circulates around every cell. So we have lymph everywhere, essentially. And so the lymph is the fluid that's around the cells, and there's a whole other, the green is the lymph system, which kind of sucking that fluid, that water out of the tissue. And that goes along a pathway to a lymph node, and you can see that there are little ducts. Now there's nothing mechanical within this system, and so in order to push the lymph from the tissue back into the system where it dumps back into the vein, you have to do a couple things. One, there has to be some breathing. It creates a negative pressure within the chest that pulls the fluid through the system. And the second thing is, as you contract your muscles, you're actually pressing on those valves in the lymph system, and it pushes around well. And that's the reason people with lymphedema need to keep on exercising and using their muscles in the areas that have swelling. And so there's the system, right? We have all these lymph nodes and the systems that are pulling the fluid and draining it into our vein system. And I'm showing in this slide because the lymph nodes that are either have an operation or radiation in the armpit from the breast are the same lymph nodes that are draining from the arm, and that's why women, breast cancer surgery, radiation, are at risk of swelling of the arm on that side. Exercise and lymphedema. So there's really a high level science that's going into this, and essentially people with lymphedema need to exercise. There's lots of huge benefits to exercising, and I said exercising, usually the cardiovascular, the stretching, and the strengthening are the three kind of main components. They need a specific regimen. They need to see the expert. As soon as a person discovers lymphedema, they need to see the expert, like right away, to give them advice and to take care of them and monitor them, etc. Takeaway point for you is yoga is safe and beneficial. We don't need to shy away from people with lymphedema in a yoga program. In fact, we want them to be there. I think this is your take-home point. Lymphedema, yoga is helpful. Again, they're listening to the body. And again, the idea around strength training is that we can teach the body to get stronger and stronger, but it has to be slowly, it has to be adapted and slow, so on. We can make a difference with time. Exercising hard, once you're prepped and going harder, the dragon boat ladies are not at increased risk of worsening lymphedema through exercising. So if they do it right, they can do everything, essentially, or at least all the strength training stuff. Treatment, there's two phases. I'll just say that the first phase, we're trying to reduce the lymphedema in a limb. The second phase is kind of a maintenance, kind of keep it at that level, and there's lots of kind of self-directed parts of that program. You'll see if someone has lymphedema, I think the recommendation is that they should be wearing a garment during class. Thank you, I've got two experts to...
They always need to have a compression garment on for exercising.
Yeah.
And even when they're gardening or doing...
Yeah, so any kind of movement, exercising, the garment needs to be on, so good. So that's the takeaway as well. So if someone shows up to class, they got some swelling in their arm, you're really going to say, I'm sorry, you need to get your sleeve on. Okay. This last issue is around the idea that some people are at risk of actually collapsing down their one of the vertebrae or one of the blocks in their backbone, right? And so it's usually almost always the front of the backbone that's at risk. So people who crunch or flex their spine are at risk if they have an extra risk factor. And the two risk factors are essentially people who have cancer in their bone. Many of them have a risk there. The older women and men, I guess, as well, whose bones are kind of thinner in some sense, or osteopenia, osteoporosis, are also at risk here. What will you do if somebody suddenly gets severe pain? You're not going to say, oh, no problem, go home in your car. You actually call an ambulance, keep them on a spinal board around their neck, and so on, because you don't want to dislodge that or cause more damage. I would say, though, in reading the data, we don't want to stay away from exercise, but there are certain exercises that actually help the bone and the muscle. And so what they said was a little more of the mild extension and in sitting in prone positions. We'll get more to this. Cancer involving the brain. So if there's a lump within the brain, whether it's a primary tumor or metastatic, we don't want to have the person doing their shoulder stands in the corner, right? You don't want to increase the intracranial pressure because that can make them feel worse. Rarely it causes the symptoms to worsen. Extremely rare to actually cause a seizure as well. If you see a seizure, no matter what situation, almost always it's going to last for a minute, maybe a minute and a half at the most. There's nothing to do. No reason to get upset because the person's going to have the seizure. They're going to be kind of confused coming out of it, be tired, maybe a sore mouth, et cetera, but essentially call an ambulance, they'll go to the hospital to figure out why they had a seizure. That usually is what happens. So, and I'm not trying to scare you, I'm just trying to say, look, some of these things are just like things that happen. Your kid vomits in the bed, you're not going to freak out and scream at them. You're going to say, well, let's just take care of you, honey, and we'll do one thing at a time. So you can have that same intelligent, efficient, effective approach in a calm space. Okay, so central lines is probably the last thing I want to talk about. So the idea is, don't want to have to put in chemotherapy into the hand and arm all the time and drawing blood all the time. It hurts. And so sometimes We can put in lines that go into the big vessels up top. And really, chatting with a couple surgeons on Friday, the central lines are very powerful and strong and resilient against this. So it's a very low risk there. I want you to just see it so you know the idea. So usually you'll see some lump on their chest. The line goes in and ends up one of the big veins up top. Access it by sticking a needle right into this little port that's on the skin itself, and that catheter goes then through the skin. So they're drawing a blood test by just sticking a needle right into that little port area there. You might see it as a line, so the person could be taped up, for instance, or some type of extra bra in that line there. It'd be very hard to pull that tube out the several 12 inches or longer that's in. So that'd be the issue, is it really coming out. So that's extremely difficult to do. That's what you might see in your yoga patient. There's a little lump on the chest wall area, maybe a little bruising there. And then there's a line you might be able to see underneath the skin, which is kind of a white catheter there. The other one is what they call a PICC line. The access is to a vein in the upper arm. So that's the site, and they get lots of bandages to kind of keep things in place. And again, it would be very hard to dislodge that area. Person's going to listen to their own pain levels. If it hurts to stretch, then you want to obviously not cause the pain, but really do the full type of exercises around that. Abdominal surgery, two things. Laparoscopic is when they put in scopes and look on the inside, so you got very small puncture wounds, and pain can dictate that. Whereas open surgery, when they're actually cutting the middle or the bottom and actually looking inside and doing all the manipulations, that takes a long time to actually have the tissue heal. And it's usually 2 or 3 months where they can only kind of carry a couple of grocery bags. If there's a hernia, which is a kind of weakening on the wall there, that can take longer. So really, obviously you're going to get the feedback from the physiotherapists or physicians as to when and how they can do things. So go slow, even in static positions. Beyond that 3 to 4 months, that's the point where people can start to expand their strength and stretching point. So laparoscopic, so you're sticking in the needles and looking on the inside, so it's a much easier surgery. Show this, so that's a scope right through the belly button, another scope up top, and the actual surgery is probably on that other side there. Whereas the bigger surgeries, the open surgeries, the cut would be down the middle, the sides. And I show you the scar from this open surgery. This is called a stoma, which is the end of an ileostomy. Essentially, it's the small bowel that comes out and sticks into the bowel wall. And so people pass their feces or stool through this site. They would put on an appliance over top of it, and that show you that picture. So the appliance is here, and the stool can kind of come into the bag, and then they take the bag off and dump that into the toilet and put a new bag on. Essentially how a stoma works.